Hello, everyone, and welcome to This Week in Hearing. In September, the American Speech Language Hearing Association, or ASHA, published the results of their OTC hearing aid survey taken mid-year. Several interesting results jumped out at me, along with several questions. Therefore, it's a pleasure to have Janice Trent, an audiologist by trade and ASHA's Vice President for Audiology Practice, join me to discuss the findings. Janice, thanks for coming on the program. Please, let's begin with you telling everyone a bit about yourself and your background.
Thank you, Joe. So nice for you, Andrew. It's so nice for you to invite us on. Well, I am an audiologist of about 35 years. I presently have a private practice in Bowie, Maryland. I had that for about 17 or 18 years. But prior to that, I was the director of the Speech and Hearing Clinic at Howard University in Washington, D.C. And then I was on faculty at Temple University in Philadelphia before we moved down here, and have done, some hospital working with physicians, doing audiology clinical work. So I come with a breadth of experience from different perspectives of the practice, of the business.
And I'm sure that breadth of experience really comes in handy at your role in ASHA. And although many in the audience already know what ASHA is, I think it would be beneficial if you'd say a few words about what the organization's all about.
Well, ASHA, the American Speech Language Hearing Association, is a profession representing speech-language pathologists, audiologists, hearing scientists. We are over 227,000 strong. We represent the most audiologists of any of the associations in the country. And, our purpose and focus is to make sure that communication is valued and is accessible for everyone. And that's our major goal. We're a patient-centered practice association. So we want to make sure that all of our professionals, well-trained, certified, having gone through extensive examination, having gone through clinical practicums, that all of them are focused, if they're working clinically, they're all focused on providing for the needs of their patients. And those who are in research are doing dynamic work in research to make sure that the services that are needed by our clients are being researched appropriately, so that they are getting the best quality services possible.
Okay, and although audiology is your focus, I suppose it's worth mentioning, at least in my thinking, is that ASHA is also the largest organization for speech-language pathologists as well, correct?
Absolutely.
So very much a focus on communications accessibility more broadly than even hearing, although hearing is what we're going to discuss today.
Yes.
Okay. So let's get on with the survey then, which, by the way, we'll post a link to it in the show notes. And if looking at top level, what would you say are the key findings?
Wow. Well, looking at top level in a nutshell, I would tell you that the key findings are that only 2% of individuals interested in over-the-counter hearing aids purchased them in the past year. What makes that stick out is the fact that this time last year, I was doing media tours with the Hearing Loss Association of America. We must have done 20 interviews across the country with news medias. Several of my other colleagues and other associations, we were all across the country promoting the over-the-counter hearing aids. And I'm sure if you remember, you probably saw it on the news.
And lots and lots of it.
Lots and lots of it, yeah. And then you had the Congress, politicians were talking about it. The president was talking about it. So I think in our mind, we were certain that with this kind of media coverage, there was going to be a big uptake of the over-the-counter hearing aids. Our association put forth a toolkit so that our professions, and even working with people who we thought might interact, i.e. the pharmacists, because these over-the-counter hearing aids were supposed to be available in pharmacies. And so we did this toolkit so that to train them so that they would be ready for this onslaught of over-the-counter hearing aids. So people were going to be coming in to get them. And so the surprise in the poll was they didn't come. And we were a little puzzled by that. And our major thinking is that, okay, we need to do more education. We certainly welcome the introduction of the over-the-counter hearing aids. Frankly, if you know what's going on in the industry, you know that only about 20 to 25% of people who need hearing aids get them. And this has been a longstanding problem for many, many years. And so we've always tried to figure out ways to bring more patients into our offices so that we could introduce hearing aids. And so we welcome any opportunity to do this. And we thought that this was going to be the groundswell, that we thought that this was going to be the real opportunity, affordable and accessible. And we really thought that we were going to see people coming through the door.
Yeah, so clearly with that, 2% must be disappointing. And I guess I just want to, thinking it through, the actual survey was taken mid-year, correct? So you're really talking about 9 months rather than the full year. But even still, 2% of the people actually purchased over-the-counter hearing aids, and another 4% are thinking about it, according to the results. And not very high when you come right down to it. And you had, in the executive summary said, or the survey said, that low likelihood of purchase is likely driven by a number of things, but one is a lack of confidence that a device could address the issue and that people could choose the correct device themselves. Now, why did you actually call that out amongst all of the different possibilities? That one was called out in particular.
We thought that making them available, and goodness knows the label on these things are quite extensive. The outside label and the inside label in terms of instructions. So we really thought that we were making it as easy as possible for patients to go ahead and try the devices. So that, and I will tell you that prior to the FDA approval, we spent a lot of time reading the instructions, trying to make sure that the way they were worded was appropriate so that patients would know what to do.
And so then what, in the end, why do you believe that consumer confidence is low in both cases, that the device will actually address their hearing loss and also that they can pick one? Why do you think the confidence level is so low?
Well, part of it, and I think we talk about this, it's not so much of a fear, but number one, as you noted, people don't feel that their hearing is that bad. Okay, so they're not going to jump necessarily on the opportunity to get the devices. But I have a slightly different take on this now. I went back and I was looking at the PCAST guidelines. That was the President's Council for Advisories for Science and Technology, and their reasoning for this was to make amplification accessible for individuals who could not afford. Okay, and they specifically outlined the fact that individuals low income had not purchased hearing aids. So the idea was that these devices were going to make it accessible for those individuals. And this has just been a thought that I've had, that if you look at the demographics that are in the study, you'll see that a large portion of them were less than high school education or just high school education, correct? That would speak to a reading level, I think, okay? And the way that the instructions are written, I sometimes wonder whether that wasn't also a deterrent, that individuals may have been challenged by reading all of those instructions. And I think that that's just another dynamic that we really haven't considered, that we were looking at making it accessible, but you had lawyers, doctors, researchers writing all of this material. Now, these are all well-educated folks, yet you're writing it thinking that the people you're writing for will be able to pick this up and read it. And I do think that might have been a deterrent also.
Okay, that's a really interesting finding. And I'll ask her, because as you said, there was a lot of effort to educate pharmacists and other allied healthcare providers. And yet, even up to the present day, and there's been a lot written about this, if you walk into a pharmacy, you might find one hanging on the rack. And yet, same thing with a big box store, and until very recently, even on a small level, could you find anybody actually well-versed in talking about over-the-counter hearing aids, their applicability and their function? Do you think that's a part of it as well?
We have gone out to talk to several pharmaceutical associations, and they're interested, but what I do get on the side at a coffee break is, from the pharmacist is, my schedule is really busy. I'm just trying to deal with the medications that I have to get out. Did anyone ask us if we would really be able or willing to manage over-the-counter hearing aids? I think that that's a real comment. They're interested, they're concerned, but they were just in real language saying, my schedule is really busy. So I think, just as you said, there are not many on the counter. I think many people are not feeling comfortable to answer the questions that they're coming to. So it's an issue that we may have to do more education.
Okay. And yes, and there may be some things outside of your control. For example, I've read, and somebody can tell me how true this is perhaps, but I've read that there's actually a shortage of pharmacists right now. And so that doesn't make it any easier, even if they're willing. And we'll have to see what the next year brings, as we started to see some of the big box stores put dedicated areas of their stores to address hearing. Like Best Buy, for example, has deployed some hundreds of hearing centers today. We'll have to see what effect that has in the second year of OTC.
Exactly.
And there was, in that statement in the executive summary, it said there are many things or other things, but confidence was one you called out. But what are some of the other things that you would note that impeded the progress of OTC?
I don't think that people really... Well, I think it gets back to the reading. I don't think when you look at it, you find out that they really don't know much about the OTC. So even though we were advertising, even though we were putting that information out, they really did not do any additional research. And in my private practice, I will tell you that I do have people coming in, and their comments to me are, I've heard something about OTC hearing aids. What can you tell me? And then that opens the door for me to have the dialogue. But to think that people, number one, they don't think they have that much of a problem. So are they going to go do the research that's going to get them to the point of actually going to purchase the devices?
Okay. And an interesting side comment on all that is I saw the latest published figures based on HIA data, quarterly hearing aid sales, prescription hearing aid sales, and they included OTC, although very few OTC companies are reporting into the HIA. So that number is going to be artificially low, but the prescription hearing aid numbers are very valid. And they showed the last reporting quarter was Q1 of 2023, the first full quarter of OTC. Well, they showed an 8% jump in prescription hearing aid sales from the same period a year ago, and it's more like 10% from Q4 2022. So do you think there's the possibility that all of the publicity and discussion around hearing comorbidities, the available of OTC, are bringing people into professional practices and perhaps responsible for the uptick in prescription hearing aid sales? Do you think that's a possibility?
Absolutely. And one of the things that we haven't talked about, not necessarily even in the poll, as I said, the PCAST started this back in 2015. And they
it seems like a million years ago.
Okay. And they were doing their focus groups even before that, because they presented their findings in 2015 to the FDA. And one of the things that we don't think about is what were some of the other players in this process doing along the way? Who were the other players? You have the hearing instrument, the hearing aid companies. You also have insurance companies. Prior to, there were a handful of insurance companies that provided a benefit for amplification. Okay. And so that was the problem, because so many individuals had to purchase their hearing aids outright. Well, since 2015, there has been a huge increase in hearing aid benefits by most of the insurers. Now, they're not always paying for the full hearing aid, but they are now giving a substantial discount, or they're paying for them, but you can get the entry level hearing aids. And I don't think we thought, we think about either the OTC hearing aids or the private or the prescription aids, not recognizing that there were other people, there were other players in the field that were responding to the introduction of the over-the-counter hearing aids. And how did they respond? They responded, and the insurance companies responded by making hearing aids available to many more as a benefit in many more insurance programs. Okay. You also have many more, and this is probably a good thing, many more hearing aid companies that are now providing lower end hearing aids that are more affordable. And frankly, many of them are more affordable as affordable as the over-the-counter hearing aids. So you've got many more players in the market that I don't think we thought about in the past. We didn't realize that they were coming in.
Which may be a collateral benefit to all this discussion about the prevalence of hearing loss, the comorbidities and so on, that you see a lot of different responses. I mean, I'm happy to say that my home state of Illinois published a law requiring that insurance companies provide a hearing aid benefit. I haven't looked at the details of it, so I don't know exactly what's included. When it's time to refresh mine, I'm going to find out. But
and I'm sorry, to get back to your original comment. Yes, even I have seen a tremendous interest in people coming through the door. And so I'd have to tell you that my sales have probably gone up in the past year because people are coming in asking the question, not necessarily coming in to purchase over-the-counter hearing aids, but certainly coming in to ask the questions about, what does my hearing aid look like? What does my hearing loss look like? Do I qualify? Those kinds of questions.
Which is wonderful because ultimately the goal of the OTC legislation was to get hearing treatment for more people.
Right.
And so all the different market responses are making that happen. And your point's very valid. I can get a professionally fitted, rechargeable, good quality hearing aid at Costco for $1,500 US, which is the upper end of the OTC space. Mm-hmm. And so the gap has closed a lot. And of course, there are lots of examples of that. That's the one I'll use. Now, in the survey, it shared the average cost of the OTC hearing aids that people purchased and that people were looking at. They were around $200 or $250, which implies that people looking at OTC are looking less at the upper end of the range where you're bumping in the prescription devices, but more at the lower end of the price range, and which speaks to the affordability. We'll get to the effectiveness in a little bit. But I do have a question for you. ASHA actually estimated the average cost, not what people bought, but the average cost overall of OTC hearing aids is $240. And considering you can get them as low as $100 and as high as $1,500 or more, how did you arrive at the figure of $240 as being the average?
I don't think that was an ASHA decision. I think that was done by the pollers. So go. I think they were doing that based on what the polls were telling them.
Okay, got it. Yeah, because pinning down an average price is really hard in the sense of do you do it per model? Anyway. Okay, so that's
right. Yeah. So I mean, we know that over-the-counter hearing aids run from about $199, frankly, up to maybe almost $3,000 a pair. So yeah, so that there is a huge range. But in this poll, this was the average price that they were talking about.
Okay, got it. And one of the things I found that was really interesting to me, and this came off of page 9 of the survey, was that stigma, including fear of aging or fear of looking old, was really low on the list of reasons for not seeking professional help. Why do you think that is? And I guess related, I'll ask if you saw any correlation with demographic factors such as age, for example, or younger people less likely to feel stigma than older ones or vice versa. Like, break that down for me a bit.
Well, I think but the key ones were cost, right? With the key
right.
So weighing that out, stigma is going to come out low. We've been able to educate away from that a little bit. It would be socially inappropriate for anyone to talk about a stigma related to hearing loss. Everybody knows that's inappropriate, and I think that that's what you're getting to. What is the socially acceptable norms at this time? 30 years ago when I got into the profession, yeah, it was definitely a stigma to have to wear a hearing aids. Now people know, I think, that that's socially inappropriate. And I think that that's a main reason that you see that low score. But more prevalent, the three things that you pointed out on the survey, those are the three major things that people were concerned about.
Okay, which I think will be music to a lot of people's ears because the stigma factor distresses a lot of people. There have even been articles written, can we stop talking about stigma already? And the fact is if your survey respondents answered accordingly, that's really good news in that respect. So it gives you the option to tackle the quote unquote real issues, if you will, like cost is a real issue, for example. And another one is actually, I would say, people's poor ability to actually predict what their hearing loss level is. And I can testify to that personally because I went the mandatory 5 years waiting time before I did something about my own. Mm-hmm. Well, because it's so very, very gradual. Mm-hmm. And it's very easy to tell yourself it's not that bad until finally it is. And that was actually the top two reasons in your survey was that people said their hearing loss was not bad enough or it's not a priority. So how do you educate people around those issues and get them thinking about their hearing loss sooner, recognizing it sooner, and all the ill effects that come with it?
Well, I'm going to go, the education is so key. But, as I read this, one of the things I thought about was the interpretation that individuals have about what a hearing aid looks like and what a hearing aid can and cannot do.
Don't get me started on all the pictures you still see with the 1970s big banana in people's ears.
That's real. Okay.
I know it is. It drives me crazy.
Right. That is real. And so what happens, so this is where the education comes in because we're still seeing those pictures being thrown up into the media of these old hearing aids. And, when I take out a digital hearing aid and present it to the patient, they say, well, what is this? This doesn't look like my grandmother's hearing aids. Right. They don't. And now let me tell you what hearing aids can do. But people are coming through the door with their own impression their own interpretation of what a hearing aid actually looks like. And so we still have those doors, those barriers to knock down. Education. We've got to get people through the door so that we can introduce them to new technology. What can new technology do for you? When I tell them, I'm going to plug these hearing aids to your cell phone, and you're going to be able to, to talk on the phone, no wires. And yeah, really, when I'm fitting a hearing aid, I'm always amazed at the shock of many patients that they had no idea that the technology was out there. Well, this technology's been out there for a while, but we have a lot to do to change the public's interpretation of what kind of services, technological services are available in hearing aids. They just don't know.
Yeah, and that makes perfect sense because, to reach the general public is very difficult, right? It's very noisy out there.
Right.
And it takes a very concerted effort to reach the general public, which goes to your, what you were saying is that if people get some exposure at least to, all the discussion about the prevalence of hearing loss and all the rest of it, at least to get them in your door as an audiologist, then you have the chance to educate them.
Right. Because, and I want to stop right there. I'm a certified audiologist. And yes, in my office, I sell hearing aids, but I do a lot more than that. So when a patient comes through the door, I'm meeting the patient where they are when they come in. Hearing loss is really a very personal thing. And when people take the nerve to come through the door, they come through the door with a lot of anxieties, a lot of concerns, a lot of concerns about the image, how is this going to make me look. Sometimes they come through the door with family issues where, they're arguing with their spouses, or they have concerns about their job because they have misunderstood what their bosses have said to them. And so they come in oftentimes with a lot of issues that doesn't mean that I'm going to immediately take out a pair of hearing aids, put it on them and send them out the door, because that's not meeting their needs. Their needs are that we have to sit down and talk to them to find out where they are, what is going on in their lives, in their communication needs so that we are aware of where they are. Sometimes it's just a matter of counseling. Other times it is a matter of fitting hearing aids. Sometimes it's health, and I've got to send them to a physician. But there's a bigger picture to hearing loss than just thinking, you come in, I do the test, I hang hearing aids on you, and I send you out the door. No, there's a whole person that we're looking in. And that's what an audiologist will do. We're not just trying to sell hearing aids, but a certified audiologist is going to be patient-centered, is going to look at where the person is in their journey before they try to just put hearing aids on. I can't tell you the number of people who come in my office and they're almost mad because my wife said I have a hearing loss, but I don't want to be here with you. And so I got to talk them through that. I got to kind of get them off the ceiling, more or less. Find out where you are, what's going on, what are your personal anxieties. Now we're in the sound booth. Nobody can hear you. What's really going on with you? And then as we talk, and this is key, we first have to talk. We have to find out where folks are first, and then we can take them somewhere. It is not uncommon for me to counsel and send folks out the door and say, when you're ready, come back and see me. And what they leave saying is, wow, well, thank you very much. I didn't know this. I'm educated. And that is the whole purpose of what we need to do. We've got to educate. My standing policy is that hearing is I do a 3 screening for anyone who comes through the door. If you come in and say, I don't know what's going on, I'm going to put you in the booth and just do a quick screen. Either you pass or you fail. If you fail, I'm certainly going to recommend you back. But if you pass, this is one area maybe we don't have to worry about. And I think that that's really critical to understand that we are looking at the entire hearing health of the individual. And that's what we're seeking to serve.
Okay. And that causes me to ask a related question, which for your own practice you described, but more generally, I would ask this question and frame it in terms of your own practice too. And that is on page 14. The survey said that just over half of people who've spoken to an audiologist were not prescribed a hearing aid. Now, in the broader sense, are those people getting whatever appropriate treatment is? So in other words, are there people walking in with a different auditory processing issue and being told, I can't help you, you don't have hearing loss, and they're just sent out the door? Or how is that working with a half of people who are not getting a hearing aid? In your view, more generally, right? Even outside your practice.
Okay. Well, we are all trained to do counseling. That's 101. But we also know that everybody who comes in with a hearing loss is not a candidate for hearing aids. The basic hearing test process, we're going to look at pure tones. We're going to see how soft you can hear a beat. We're going to look at how soft you can hear words, baseball, cowboy, toothbrush. Then we're going to make sounds louder, and we want to see whether you can process that information. Say the word bass, say the word gun, at a comfortable listening level. Now, if you can't repeat those words when we put them at a comfortable listening level, that's a flag for us. And that says that we need to send you out to an ear, nose, and throat doctor for assessment, because you ought to be able to hear when sounds are made loud enough. And now there are some situations, people will come in, they've had a stroke. Well, I got to know what I'm going to see when I know they've had a stroke. But everybody who comes before us brings different types of hearing loss. And that's probably my biggest concern when we're talking even about the Oakland County hearing aids, because every hearing loss is not just, hearing loss. There are other issues that play into what's going on. So as I said before, some people come in with a mild hearing loss. And the World Health Organization years ago came out with some guidelines. So, and one of the things they said is that people can have an impairment, mild, moderate, severe hearing loss, but you can also have a handicap. So how does your impairment impact your daily functioning? I have had individuals who have mild to moderate hearing loss, or mild hearing loss even, who are devastated, who just, I can't hear, you need to do something. And even I'm thinking, really? But when I put a hearing aid on, their faces light up and they're like, yes, I need this. And then I have other people who I put the hearing aid on and they say, I don't really notice a difference. Sometimes I'll send them out for a trial, go use this for a week, see if it does make a difference. And many times they come back and they say, no, it doesn't make a difference. They have different coping strategies. So they are not handicapped by their hearing loss. They have one, but they're not handicapped, and that's fine. I'm going to give them some strategies to use and say, come back and see me if you notice that you're having a problem. But those are some of the variables that we have to look at when a patient comes through the door.
Okay. And so in the survey then, this really speaks to the survey result that showed a little over half of respondents were not satisfied with the performance of their over-the-counter hearing aid. And how much of that do you think is related to the actual performance of the hearing aid, and how much is related to the fact that their auditory issues are not your classic pure tone hearing loss that an over-the-counter hearing aid is meant to address?
Well, there's another factor, and how much of that is related to the fact that they have not received appropriate counseling in adapting to the hearing loss, okay? And that I think is the bigger problem. Hearing aids are not eyeglasses. They're just not. They're not the same. And so when you get a hearing loss, you get hearing aids, you need counseling. My folks are coming back to see me 2 or 3 times before I let them out, before I say, okay, I'll see you in 6 months. Because we need to figure out what's going on. The first time I set them, I'll own it. This is what I think you should like. But I need to see you in 2 weeks so we can talk about it. And oh, by the way, I didn't turn these all the way up, because I think for me to turn them up to the target for you may be a little overwhelming. So I'm going to turn them maybe 80%. And I want to see you in 2 weeks. And maybe in 2 weeks when you come back, you can critique it for me. You can let me know what you liked, what sounds you didn't like, what noise was too much for you, what speech was not clear enough for you. Then you come back and we sit down on the computer. I take their critiques, their observations, and now I'm going to try to fine-tune the hearing aid so that it's comfortable for them. And I may turn it up to 100%, but I might go from 80 to 85%, and they say, oh, that's enough. Fine. Go out with it at 80%, and I'll see you in 2 weeks. And maybe in 2 weeks, I'll be able to turn it up to 90%. And maybe it's going to take me 4 or 5 weeks to get them up to 100%. And maybe some people, I will never get up to 100% of the target. That is okay. But the issue is communication. This, as I said, hearing loss is not like any other disorder. Even when you go to an eye doctor, you go to the eye doctor, he tweaks it, and he sends you out the door. Very seldom do you have to go back for a follow-up visit. But with an audiologist, even with the best technology, and there's some great technology, you're still many times going to have to come back, if not for a fitting, to be desensitized or to be sensitized to your experience. What I mean by that is several years ago, I had this big military guy come in, and he had this huge booming voice. Funny as all get out. We had a ball. And but his wife said he can't hear. And so I put the hearing aids on him, and he started talking in this big booming voice. And the first thing he said to me, these hearing aids are too loud. And so I laughed and I said, well, I need you to turn your voice down. And he was like, really? And I said, yeah. So when he turned his voice down, he was like, oh, okay. So we had a lot of fun, and I sent him out for 2 weeks, and he came back, and he was contemplative when he came in, and I said, well, what's going on? And he said, I am a high-level exec, and I'm a big man, and I saw my subordinates recoiling when I spoke to them. I saw them backing up, and in my mind, I was like, I wonder what's wrong with them. He said, I didn't realize that I was yelling at them. He said, and I wish I could find them because I'd apologize. Because he was retired at this point. He said, I didn't intend to yell at them, and I didn't know that my hearing loss was impacting me in such a way that I was having an impact on people that I was communicating with. Now, that was a great introspective observation that he made, but he made it on his second or third appointment with me, and we were able then to have a discussion about the impact of hearing and how do you talk to people and how do you listen to your voice. So these are some of the things that we do as audiologists. Beyond just putting a hearing aid on and fitting, we're the ones who take time to talk about what's going on. So not only are we educating, but we are counseling, and we are equipping the individual to go out a more confident and assured hearing into the hearing world. And that's what's really important.
Well, and I'm actually the poster child for everything you said there. I would say I was first fitted 5 years ago, and I didn't even make it out of the office at 100%. Like, I got fitted, and then the audiologist set off her printer to print out my receipt, and I jumped out of the chair. It almost hurt. And so, yeah, she turned it down. And then some weeks later, I came back and I said, here are my observations. I said, well, first thing, let's get you back to 100%. And then I came back describing some situations that, because I've been an audio person my whole career, I could give it to her pretty straight. My message to her was actually that it almost hurts and sounds a little bit distorted when the altos in our church choir get going. She's got, okay, I got you covered, and then adjusted the compression settings there and all that. So it actually took 3 or 4 visits to make it all happen. And I would say if I had, say, 10 years ago, if OTC had been available, I probably would have been fine. But by the time I perceived my hearing loss to be bad enough where I needed to address it, I was at 2 and 4 kilohertz in severe territory, so it was kind of too late. Even though the pure tone average said moderate, I've got the big hole in the middle that comes with noise induced, and so it would have been too late for me. And so I think that's really just everything you said resonates with me personally. And then, so that seems to be part of the not satisfied. I guess then my question is people, according to your survey, are generally buying at the lower end of the price range, and half the people aren't satisfied. But from what I'm hearing you saying, it may not be price performance so much, or some mix of price performance because they're buying lower end devices, and some mix of they're just not appropriate for where they're at, right? That what their needs are beyond what OTC can supply. Is that a correct way of stating it? And how would you kind of see that mix? What percentage?
Now, the over-the-counter hearing aids are kind of a do-it-yourself device. You go to the store, you read the instructions, find out whether you can return the device. You open up the package and you fit yourself. Okay? You just heard me say how many times patients come back to my office. You just told me how many times you went back to your audiologist. Hearing aids, whether they're over the counter or prescriptive, need follow-up care. So the frustration that we see in this poll relates to the fact that many times these individuals purchasing over-the-counter hearing aids are out there by themselves, and they don't have the education and the support to help them adapt. Once again, I'm hitting this mantra: education, education, education. And that's what a certified audiologist will help the individual do.
Okay, thank you. Now I'm going to ask a slightly different question, because you had some interesting demographic data in the survey as well. Okay. And one of the things that jumped out at me was that people who identified as having hearing difficulty, nothing to do with what they purchased, but people identified as having hearing difficulty, was correlated with lower income and education level. Okay. So why do you think that people with lower incomes and lower educational levels had a higher prevalence of hearing difficulty as self-assessed?
Well, that's not really the case. Hearing loss affects everyone regardless of your socioeconomic level. But if you go back to the research, starting with PCAST, the purpose of the over-the-counter hearing aids was to serve individuals who could not afford to purchase the prescriptive hearing aids. Those 6,000 or whatever that top number is that people always talk about when they think about purchasing a hearing aid. I can't afford that. It's too much money. And so that is what's in their head. Okay. What you also noticed in the study was that the education that showed in the poll for educated individuals in POT was very low. Well, the whole design for the over-the-counter hearing aids was to serve individuals with lower education and low financial status. Okay, that doesn't mean that on the other side of the spectrum, the individuals with the wherewithal are going to go to the audiologist and get their hearing taken care of. So that I think is the distinction. I don't really think that necessarily more. There are health issues that certainly do arise, but across the spectrum, I think what you're going to see is that the issue is that healthcare is more accessible to individuals who have healthcare, who have education, and they're able to manage it. People who are looking at over-the-counter hearing aids don't have health insurance, are not educated, and that's, or not, I'm sorry, they're not, but they don't have a high level of education. So now you see them coming in because they're looking for something. They need something, but they know they can't afford the high end. And I think that that's more what we're looking at. And that's really what the OTCs are about. They try to reach those individuals who can't afford that high end hearing aid. But as a caveat, I just want to mention that there are a plethora of hearing aids between the over-the-counter and the high-end hearing aids that many people could be fitting in. And oftentimes we don't talk about that. When you hear in the media, it's always hearing aids are super expensive and I can't afford it. Yet there are many, many more prescriptive hearing aids that are much more affordable that individuals could be purchasing.
Okay. No, I think all that makes perfect sense. But I did notice in the demographic data there actually was, so I'm looking at it here now, demographic profile, those with hearing difficulties, 43% with incomes below 50K, 27% from 50 to 100K, and 21% from 100K plus, which is just what you said. I mean, hearing loss is everywhere, but people who self-report it were a little bit more skewed towards lower incomes. I mean, when I saw that, I wondered if that was occupation related, that people with lower incomes are more often in these sort of loud occupations that can cause more noise-induced hearing loss. And that's what I was wondering if you had any idea behind that finding in the survey.
Yeah, I think that there's some of that. But, dentists, there are many people, there are truck drivers who are exposed to noise, but they make a really good check. And when they need hearing aids, they go purchase them, okay? So I think that that's the difference. Now we're talking about people who do not have either the financial wherewithal or they don't have the health benefits that will allow them to purchase a hearing aid.
Okay. So that makes perfect sense then. So there might have been people who have no insurance, right? Mm-hmm. And up until the advent of OTC, and even perhaps in the advent of OTC, you see disproportionate amount of people complaining about hearing loss because they haven't been able to get it treated. That's what I think you're saying in part. Okay.
Yes.
Okay. That makes a lot of sense. And really, the probably the last thing that jumped out at me was by the nature of the survey and the low percentage of people who actually purchased OTC hearing aids. When you get to those parts about the attitudes of people who actually bought OTC hearing aids, the N is pretty low. So it implies that when you do this again, you either have to widen out the number of people surveyed in the first place, or if the percentage is higher, you'll get a higher N. I mean, is that on your mind as you think about repeat versions of the survey?
Well, I don't know. From my perspective, a lot of this information is very consistent with the perspective of many, many surveys that have gone out over the years to individuals about why they don't purchase hearing aids. These reasons are consistent across the board. And I think that it's not just enough to double the number of N. I don't know that doubling the N is going to make the data any different. I think what we really need to look at is our strategies that will help individuals overcome whatever roadblocks they have up. So it's not fear. They said it was cost. OTCs are affordable. So it wasn't cost because they didn't go and get them. Okay. It's not that bad, but in reality, many of them, now who could talk to them, many of them will have to acknowledge that maybe they are having trouble. One of the things that I do oftentimes is when I have patients come in, I always have the third party. The third party is the adult child or the spouse. So while one person is telling me, I really don't have a problem, the doctor sent me here, but there's nothing wrong. Then I have the parent or the child or the spouse behind them going, That's not, that's what we can't hear. And so that's the other dynamic. And so that's why I said, to ask someone, there are very, very few people that I meet in my office that come in and say, I really have a problem, I can't hear. When they're coming in their office, there is something that has happened that has made them decide that they have to do something. My running joke is that 90% of the men who sit in my chair will say, my wife said, there's something wrong with my hearing. So now something has gone on in that relationship that he has finally said, if I don't do something, I'm going to be in big trouble. There is an impetus. There's something that gets them in the door. But it is very seldom that somebody just comes in and sits down and says, hey, I think I got a hearing. And I'm not saying they don't do it, but I'm saying that usually when you talk to them, something has happened. Something's going on in the job. Something's going on at home. The adult children feel guilty yelling at their elderly parents. Now, they're not yelling to be mean. They're yelling because their parents can't hear them. But there's a lot of guilt that comes in from yelling at your parents, and they're saying, you got to do something. Number one, my voice is I'm getting hoarse. But number two, I'm out in the stores, and I'm yelling at my mother so that she can hear me. But people look at me and think I'm being disrespectful. I'm not. I'm just trying to help my mother hear. So oftentimes it is the reason, it is the frustration that gets people in my door. Not somebody just coming in and saying, I don't think I have much of a hearing loss. That doesn't happen. I get a lot of referrals from physicians, and oftentimes it is the physician who will say, medically, I need you to go have a hearing test. I need to go for you to go check this out. And they will come in, and what they will say to me is, well, the doctor says I have a hearing loss, but there's nothing wrong with it. And, I'll test the hearing, and I'll say, yep, the doctor was right, you do. And then they're completely shocked. So, I think that that's what we're looking at, is not really expecting that at this point, not really expecting that people are going to be self-aware, and many times to say, oh, I've got a hearing loss. Oftentimes it is the circumstances in their lives that gets them into my door. And so we want to have opportunities where they can get through the door of an audiologist, through the door of an ear, nose, and throat doctor, if it's more medically related, so that they can then get on their path for better hearing health care.
Okay. And I think the takeaway from that is that hearing loss is about relationships more than anything else. With your family, with your friends, with the people in your workplace. That for me is the key takeaway, that if you want to have the most satisfying relationships in all phases of your life, you're doing yourself a disservice not to treat your hearing loss.
Absolutely.
So we've covered a lot of ground today, and I appreciate you taking the time to discuss the survey in such detail. Before we end it, do you have anything else to add?
Well, just that over-the-counter hearing aids are certainly the entry level. And we, as I said, we want to get people just aware of it and coming on through the door, doing something about it, because we think that that's so important. Education is critical. We are there as certified professionals. We are there willing to talk to you, to counsel. We've got plenty of surveys that we can give you to talk about what's going on in your life, and how does the hearing loss make you feel? I mean, we have lots of that we can talk about. And we want people to feel comfortable coming in. We're non-judgmental, but we want to find out what's going on in your lives. And we also want to help you where you are. We are not trying to make people do something that they don't want to do, but we do want to educate. Because as I said, some people think that the hearing aids that are available are their grandmother's hearing aids. Not the case. And so we want to make sure that people are aware of that.
Okay. Oh, thanks. Really, thanks. It was a very enjoyable conversation. Now, if people want to reach out to you, how would they do that?
They can reach me through the American Speech, Language, and Hearing Association. They just reach out to Dr. Janice Trent, Vice President of Audiology Practice at ASHA, and they will get all the information you need.
Okay, great. Thanks a lot. And really, thanks for joining me, and thanks to everyone who watched or listened to this episode.
Thank you so much.